Hello all my viewers, welcome back to my YouTube channel. My name is Terry and my channel name is Terry the Arena and Kids. So welcome back to this channel. This is a channel where you get to learn a lot about health, about how you should take care of yourself. So because all of you know that I am a nurse by profession, and I'm really passionate about teaching, just to ensure that the community we live in is healthy, like everybody is healthy, and that we ensure that people get information that they need regarding health. So today I want to talk about diabetes, what you should do to avoid getting diabetes, and if you have diabetes, what are you supposed to do? So I've had several people asking me what are the signs and symptoms of diabetes, because they're not sure. It's a bit confusing, and I will want to tell you this, that if you have these signs and symptoms, you just need to go to see a doctor so that you're checked. Number one, excessive thirst. You can say Mombasa is hot and people take a lot of water, but that excessive thirst, you take water, and every time you take water, it is accompanied with excessive micturition, that is excessive urination. Every time you're in the washroom, you're passing urine, day and night. It's not only during the day, it's day and night. You're not able to sleep because every time you're going to pass urine in the washroom. So it can confuse you with urinary tract infections, because those who have urinary tract infections, they also get frequency in micturition. So the only way is to go for a sugar test. If you do a blood sugar test, you will know if your sugars are high. Your doctor will do more tests to arrive to a diagnosis. So the other thing is, I said, excessive thirst. Some people will have some wounds that are not healing. You apply, you do your dressings, but a small wound takes so long to heal. Other people will get weight loss. You have weight loss that you're not able to explain. If you have weight loss that you're not able to explain, also go for checkup. These are lifestyle diseases that are coming up sometimes when you're 40 years and above. For those who have diabetes, maybe it is genetic, it is in the family. There's a strong family history of diabetes. Maybe some other people in the family have diabetes. At least you're able to know, because once you know that maybe your mom, your dad, your brother, one of your brothers is diabetes, so you should also check, so that you get to know early, you get to be diagnosed early, so that you are able to start on medication. So if you have diabetes and you don't seek treatment, it can lead to complications. So many complications. Some people have lost their sight because of high sugars. Some people have developed kidney complications. Some have gone into having end-stage renal disease, and they have to be dialyzed like 3 times a week because of the effects of diabetes. So it's very important to be checked early. Some people have gone for amputation. That is if they have a diabetic foot, and maybe the venous supply is cut, you have to amputate that limb. So you end up having one limb because of diabetes. So it's very important that we check ourselves. It's always important that we go for regular checks for a normal human being, just like the way you take your car for service. I think it's now important that we also go for checkup at least twice a year. If you go, just take it to yourself to a hospital, get admitted or as an outpatient, run all the tests to ensure that we are healthy. Otherwise, you realize that you're diabetic when you have already it's already affected your system. So please, I'm really I'm encouraging you to go for checkup and also talk about read more on diabetes, read more on complications, read on management, because it's very easy to manage diabetes. If you're put on injections, you're actually taught how to do it. The nurses will teach you how to do self-injections, and you just go home with your insulin. Nowadays they're very friendly. You have the insulin pens. You can go with it in your office, in your workplace if you're traveling, or you have your own glucometer. You're able to check your sugars just to ensure that your sugars are under control, and then you give yourself the injection. So the nurses will actually if you're taking the injections home, the nurses teach you how to inject yourself, how to ensure that you rotate the site so that the insulin is absorbed in the body to ensure that your sugars get regulated. So it's very important to understand yourself. You can treat diabetes. Some people have been diagnosed with diabetes and have been advised by nutritionists to just control sugar in their diet, cut down on the carbohydrates, live a healthy lifestyle, exercise, and the sugars have gone back to normal, and they're only doing diet. And I think it is very important for all of us to be careful, to ensure that we get knowledge on diabetes. So I am joined in here with my daughter. Welcome, Mara. I was just talking about diabetes and what to do to ensure that you're able to manage yourself when you're diagnosed to have diabetes, and that you don't get to go to having complications of not getting good management. So until if you have any questions, kindly don't hesitate, ask. I will also respond. Like today I was responding to a question that a client asked, so I said let me do a video so that I can reach out to as many people as I can. So until next time, continue subscribing to my YouTube channel, share my videos to help me grow, and I am really grateful for your support. I'll say bye bye for now. Thank you.